Hello, everybody. Today we're going to be talking to you about why your mouth matters and the importance of caring for your overall health and how this affects your overall health. My name is Caitlin Hawk. I am going to be narrating slides 1 through 5 for us. Catherine is going to narrate slides 6 through 10, and Marissa will narrate slides 11 through 15. Catherine and Marissa are senior dental hygiene students at Columbia Basin College, and they're going to be graduating next month. I graduated from this same program in 2014, and I have been practicing as a registered dental hygienist for about 5 years and decided to return to the degree completion program at Columbia Basin College so that I can receive my bachelor's in dental hygiene. So we're looking forward to sharing this information with you and hope that you guys can all take something from it. Over the past couple of decades, doctors have started to recognize that there is a major connection between your mouth and the rest of your body. Your mouth is the gateway to the rest of your body, and so because of that, keeping it clean and healthy is going to contribute to staying healthy overall. Studies have started to show that an unhealthy mouth can contribute and is related to things such as heart disease, which is one of the #1 killers in our country, diabetes, and even cancer. These are major health problems, and although they're not directly caused by an unhealthy mouth, having an unhealthy mouth can contribute to these things and make them worse. So every day our mouths are exposed to different bacteria and bugs, and these bacteria thrive in an unclean environment. So if you're not brushing your teeth every day and flossing every day, that bacteria is not getting removed and it's just growing and causing more issues. So the importance of brushing and flossing is extreme. And the mouth is connected to the rest of the body also, in that the germs and bacteria in your mouth can spread to the rest of your body through your bloodstream. So it's extremely important to remove those bacteria and germs because they are going to cause a lot more damage even in the rest of your body. So this image is to give you a visual example of some of the things that poor dental health can be related to. So some of the ones that are more well recognized are things such as dental decay or cavity. So not removing the bacteria in your mouth, that bacteria can slowly start to eat away holes in the teeth essentially. And if they get large enough, they can cause pain and lead to tooth loss. The bacteria in the mouth can also release certain acids and things that contribute to bad breath. And gum disease is a huge issue with having poor dental health, as the bone and the gums and the ligaments that hold and keep your teeth in your mouth start to deteriorate. It's irreversible, and this can also contribute to tooth loss. So up towards the top are some things that a lot of people aren't as aware of, things such as lung conditions, strokes, heart disease, cancer, and diabetes are all things that poor dental health is related to. So if you already have diabetes or heart conditions or mouth cancers already, having a poorly taken care of mouth can contribute to these conditions not getting better, making it difficult to control. So a healthy mouth is extremely important in staying healthy overall. This slide is to give you an idea of the difference between what healthy gums appear like and what unhealthy gums appear like. These photos are more extreme. We have an extremely healthy mouth and an extremely unhealthy mouth. There can be some in between where the gums are slightly irritated, but this is to give you a general idea of what to look for in your own mouth. On the left, you can see the gums appear very light pink in color. They are tight around the teeth. There's no obvious bleeding, really no redness, and overall this exemplifies a healthy mouth, healthy gums. On the right, you can see that the gums appear much more red in color. They are looser around the teeth. You can see On the bottom, the gums are so puffy, they're starting to pull away from the teeth and expose the roots. There's more obvious bleeding. The gums have started to really pull away from the teeth and loosen up. There's most likely a lot of sensitivity when this person brushes or flosses. It's most likely painful and would bleed a lot. So in general, healthy gums are going to be light pink, minimal bleeding when you brush and floss. And if your gums are very uncomfortable to brush or floss, or you notice a lot of bleeding when you do, most likely you need an assessment by an oral health professional who can give you a professional cleaning and get back on track towards having the healthy gums. So if your mouth is unhealthy, there's some things you're at higher risk for having to deal with. Some I've mentioned, such as bad breath, and this is going to contribute to how you interact with other people. I've had lots of people come into our dental office complaining that my mouth tastes bad, or my spouse always complains my breath is bad, and I brush and I floss every day. And so normally there's an underlying issue, and as you can see, this really affects people's everyday life. Another big one is tooth loss. Over time, dental decay and cavities and gum disease can contribute to losing teeth, and this is going to have a major impact on your ability to eat, which in turn is going to affect your overall health because you're not able to as easily get the nutrition your body needs if you're not chewing effectively. It also is tooth loss is going to really impact your ability to talk properly. I will have people who have a tooth pulled and come back and say, I had no idea it was going to affect how I said this word or that word. I almost had to learn to talk differently because I'm missing that tooth. So tooth loss really impacts your everyday life, and so preventing having to lose teeth is such an important thing. If anyone's experienced tooth pain, they know that it's really awful, and so untreated cavities and gum disease can lead to major tooth pain and sends a lot of people to the emergency room. So again, these are all things that we want to prevent by educating you on the importance of really taking care of your mouth. So not only have studies shown that poor oral health can contribute to poor overall health, but it can also affect your mental health. Studies show that you're at higher risk for depression and feeling sad if your mouth is in a poor, unhealthy state, as well as social anxiety, because having healthy teeth really affects your ability to interact with other people. So again, taking care of your mouth is so important because it affects your everyday life.
Plaque is a sticky white film that collects on your teeth every day. It is made up of bacteria or germs that live in your mouth and feed on the sugar you eat and drink. The longer plaque sits on your teeth, the more pathogenic it becomes, and it will start to attack the teeth. This is why plaque should be brushed and flossed off your teeth daily, or it can cause cavities and gum disease, which leads to tooth loss. So what exactly is a cavity? A cavity is a hole in the tooth that grows bigger over time if it doesn't get repaired. The tooth cannot repair itself after a cavity gets so bad. It must be stopped and removed by a dentist, or it will continue to get worse. Cavities are caused by plaque that does not get brushed or flossed off the teeth. Cavities can become very painful and lead to tooth loss. We floss because plaque gets pushed under the gums and cavities can form on your tooth roots, which are much harder to treat. Brushing and flossing every day is the best way to prevent cavities by removing that plaque. In the beginning, cavities may appear as a chalky white color, usually along the gum line, and as they progress and get worse, they appear dark brown or as a little black hole in the teeth. Gum disease is just as dangerous as cavities. It's caused by the same plaque and bacteria as a cavity that builds up in the mouth. Early stages, the gums appear red and puffy and are tender and bleed easily when you're brushing. It is reversible with proper care and professional cleaning at your dentist. However, as it progresses and gets worse, the gums become even more swollen and bleed even more easily. The bacteria starts to actually eat away at the gums, and you'll start to think your teeth look longer and the roots will start showing. And eventually this bacteria will start attacking the bones that are holding your teeth in place. This is not reversible, which is why we want to stop it as soon as possible. This is again done at your dentist and may require a deeper cleaning in order to remove all that bacteria. Gum disease is what leads to wiggly teeth that eventually fall out, because the bone structure that holds the teeth in place is no longer there. Here's some examples of what gum disease looks like. At the bottom, we have an example of healthy gums. You'll see the gum tissue is pink and it fits tightly around each tooth. During gingivitis, or the early stages of gum disease, the tissue starts to turn red and a little puffy around the teeth and may start to be tender. We call severe gum disease periodontitis. As you can see in the last image, the tissue becomes really red and inflamed because the tissue is actually fighting an infection caused by that plaque and bacteria. It becomes really red and puffy and bleeds very easy. It can also be very tender or have no pain at all. Other ways we can keep a healthy mouth is by monitoring our diets. Because plaque and bacteria thrive on sugary, soft foods, the more of these we eat, the more bacteria we will accumulate. The bacteria and plaque love sugary foods. Sugar allows the bacteria and plaque to release acid on the teeth, which can cause cavities. Eating things that stick to your teeth increases your chance of these cavities. Sugar is not just found in candy and treats, it's also in breads, crackers, chips, and anything made up of carbohydrates. Whenever you eat a sugary food, the acid that is released on your teeth can stay on there for up to 40 minutes. This is why snacking frequently increases your risk of cavities. Every time you snack on a sugary food, the 40-minute acid attack restarts. But eating fruits and vegetables can help neutralize these acids and help the mouth get back to normal. Rinsing your mouth out with plain water is also a great way to get rid of the acid. Did you know that even sugar-free beverages such as diet soda are harmful for your teeth? Almost all drinks besides water has acid in them.
Like we just discussed, what we eat can play a big role in the health of our oral cavity. It is especially important to brush and floss every day. Ideally, brushing at least twice and flossing at least once. Missing just one day can lead to hard deposit buildup quickly. It is also important to keep in mind that avoiding sugary and sticky foods and drinks can be very beneficial in the fight against cavities. However, if you can't live without soda or candy, having it all in one sitting is best instead of constant snacking throughout the day. It is also important to recognize that drugs can have a devastating impact on your oral health. Drugs are known to cause severe dry mouth, which in turn lead to cavities as the acid that is produced from sugars in the foods you eat and drink can more easily rot the enamel. Another common side effect of drug use is the increased craving for sugar, again leading to prolonged acid attacks to the enamel. Methamphetamine is made from very acidic materials, again, which can quickly rot the teeth. Another side effect of drugs is decreased blood flow. Decreased blood flow to the gingiva can greatly increase your risk for gum disease. Bad habits also, which can be side effects of drug use, can include grinding of the teeth and not caring about oral hygiene, which can both lead to cracked, broken, and rotted teeth. Luckily, we have a way to help strengthen teeth after acid attacks occur. Fluoride is a naturally occurring mineral that can slow the growth of cavities by strengthening the teeth. Fluoride is added to most toothpastes and some mouth rinses. In some cities, a safe amount of fluoride is added to the water to help combat carious lesions. Pasco is one of these cities that has added some to the already naturally occurring fluoride in the water. Again, we just want to hit on the basics of brushing and flossing. Brushing twice a day, once in the morning and once before bed, can greatly improve your oral health and lower your risk for getting cavities. Brushing for 2 minutes and angling the brush to 45 degrees while brushing are key. Flossing at least once a day can also help to remove buildup that is missed when brushing by scrubbing the sides of the tooth and is able to get under the gum line as well. Remember that healthy diets play a role in lowering the risk for cavities too. Avoiding sticky and sugary foods and drinks can help, as well as a diet full of various fruits and veggies. Snacking throughout the day can be detrimental to our enamel also, so eating and drinking only at meal times is best. There are a few low-cost or free clinics in our area that are easily accessible. Tri-Cities Community Health, Grace Clinic, and our clinic at Columbia Basin College are each great options.